Hi. I'm robo-Suzie and today I'll talk to you about some symptoms of high cholesterol. Also don't forget to subscribe for more tips in the future. But back to our topic. The symptoms of high cholesterol are sometimes invisible, but telltale signs include shortness of breath, pains in the legs when walking or running, and weaknesses in the fingers and toes. As the degree of cholesterol in the bloodstream rise, so does your chance of cardiovascular disease or stroke, so it really is worth having them checked regularly. As we age, our blood cholesterol starts to rise, usually beginning in our 20s and rising far more sharply after the age of 40. Women before menopause have levels which are below men of a similar age. When a woman is experiencing the menopause, her levels of cholesterol and proportionate risks of CHD will usually rise. In the developed world, for both men and women, heart disease continues to be the #1 reason for death. High cholesterol levels, however, are modifiable, so it is definitely worth having your cholesterol levels checked regularly to reduce the risks of heart disease. High blood cholesterol amounts within the body may be induced either by environmental or hereditary factors. They can also be affected by your lifestyle, your levels of exercise, and the type of diet you eat. Any diet that includes a lot of saturated fats, trans fats, and hydrogenated fats is bound to increase cholesterol. High cholesterol levels are generally connected to arterial deposits, even though it is in fact the LDL cholesterol which is responsible. This condition's medical name is atherosclerosis. This causes a buildup of deposits within the arteries which reduce the volume and restrict the flow of blood through them. If this condition persists, it may cause those blood vessels supplying your heart to become so narrow insufficient oxygen is delivered to the heart muscle. This can cause you to feel chest pain, angina. If one of those plaques is dislodged, it could cause blood clots. They are very dangerous as they can either block the blood flow to your heart, in which case you will suffer a heart attack, or your brain, in which case you will suffer a stroke. Consequently, it is extremely vital that you monitor blood cholesterol levels to avoid these situations. Medical reviews indicate that there's a relationship between high cholesterol and stress. Tension leads to added hormones to be introduced, which could cause clinical depression, cardiovascular disease, a reduction in our body's immune function, and have many added consequences. Add to that the increased threat from comfort eating, especially of greasy foods, and LDL cholesterol levels are certain to rise. An underactive thyroid gland, a liver or kidney disorder, or badly controlled diabetes can all contribute to higher cholesterol counts. Certain medicines, including steroids, beta blockers, and some diuretics, can also influence blood lipid levels, and smoking raises the danger of arterial blockage dramatically. There are a number of specially designed food products, for example, some spreads and yogurts, which are aimed at those who want to bring down their cholesterol levels. Typically, they include substances such as plant sterols and stanols, which can help diminish LDL cholesterol. If you decide to use these products, always check the label and make certain that you do not consume too much. Pregnant women and nursing mothers should use caution when using any of these products, and nobody should eat too much of them for safety's sake. That's it. Thank you. Please subscribe, comment, and like this video if it was helpful. See you soon.